I was very excited to attend the ASCO 2021 virtual meeting and see so much really important and impressive data across tumor types and across disease settings. I would like to highlight a little bit a great effort by many colleagues working on COVID-19 and cancer. And obviously, we have been involved in that effort with the COVID-19 and Cancer Consortium, along with many colleagues. We formed this consortium in the beginning of the pandemic in March 2020, and now we have been able to publish our updated follow-up with about 5,000 patients in the Annals of Oncology, looking at putative prognostic factors and trying to shed some light about the outcomes and the different risk factors of patients with COVID-19 and cancer. At ASCO 2021, I was honored to be the discussion on a very interesting session looking at different data from the ASCO registry. Dr. Malham and colleagues did a fantastic job with the ASCO registry, looking at different potentially prognostic factors, for example, age as a prognostic factor in patients with COVID-19 and cancer. And their poster had a lot of useful information, which I would like the audience to be aware. And I want to congratulate them for this effort. There was also some interesting findings in this abstract, as well as an abstract, a poster by Dr. Guarneri from Veneto, Italy, that showed that over time, the 30-day mortality, the mortality for patients with COVID-19 and cancer decreased, went down as we evolved during the pandemic from the early months, March, April, May, to later months. The severity of disease and mortality was lowered, and we tried to figure out why this happened, which are the factors that led to this lower decreased mortality over time during the pandemic year, because this can have implications, obviously, how to keep optimizing the outcomes of those patients. The other important effort was by Dr. Subaya at the MD Anderson Cancer Center and her team. They did some really amazing work looking at real-world evidence, real-world data on patients with cancer who received the vaccine against COVID-19, a particular vaccine, and in this particular study, despite the inherent caveats and limitations of not being a clinical trial, they were able to capture real-world data. And from the data cut they had, it showed that they showed very well that patients with cancer who received a COVID-19 vaccine, this was one of the mRNA vaccines, did well, and the vaccine was safe and effective in patients with cancer with a very high number of patients getting the vaccines. And overall, these patients did very well with overall not significant side effects. The vaccine was well tolerated. And also the efficacy was preserved as we know it in patients in the overall population. So corroborating again the importance and the high priority to get the vaccine out there as soon as possible to patients with cancer, which represent a group with higher risk and worse outcomes. So overall, despite again the inherent challenges of not being a clinical trial, Dr. Subaya and colleagues showed that that particular mRNA vaccine was overall safe with no significant clinical relevant side effects in the majority of patients and effective. So I think more studies are needed in that regard from other cancer centers, and of course, longer follow-up as well as evaluation of other vaccines that patients with cancer may have received, as well as additional findings in terms of quality of life of those patients, imaging findings, so on and so forth. So we're very, very exciting overall to see the evolution of the data sets in patients with COVID-19 and cancer. There are so many registries and consortia, including the COVID-19 Cancer Consortium, but many others exist. And I want to congratulate the effort from many investigators across the globe who try to push the envelope forward and keep the scientific principles during the pandemic, trying to generate more knowledge that can help the field and the patients. I would like to thank you for your attention. And again, hopefully you enjoyed ASCO, and hopefully we'll have a face-to-face meeting when it's safe in 2022.